Good morning. I'm LaShondra Shaw, PIO for the City of Austin, and I am the moderator for today's media availability. Spanish interpretation of this media availability is on ATXN 3. To start, Austin Public Health Director Stephanie Hayden will say a few words, followed by Austin's Public Health Chief Epidemiologist Janet Pichette, and then Dr. Mark Escott, Interim Austin Travis County Health Authority. And then we will open it up to our pool reporter who will ask questions on behalf of the media. Stephanie?
Safety is first. I want to spend a little time today just to provide a few reminders for us because safety is first. Our goal is, as a city, we've done very well. I would like to really commend Austin and Travis County residents because where we are right now is based upon the behavior that you have displayed. Education is one of our main priorities. We want to make sure that we're able to get our young people educated and our college students to get their education as well. But we know as we start to reopen, my concern here is that we will get too comfortable. As we look at what we've done from a historical perspective, we've moved in a positive way. We've been able to mitigate the spread of disease. And it's so important for us to continue to social distance, to wear your face covering, ensure you have hand hygiene, and you are also only going to places where it's essential for you to go. The other thing that's I'd like to touch on is that we still have testing available. We are providing testing in our community, and it is flu season. Flu season started October 1st, and we will be providing some locations where we will be providing flu vaccines in our community. We are going to partner with other entities in order to bring them to our zip codes that have high positivity rate, but also at locations where it's going to be convenient for you to get there to access that flu vaccine. I will turn it over to Janet Pichette.
Good morning. I do want to repeat some of what Stephanie has mentioned and mention to people that Austin and Travis County are in a good position right now. We have a very flat curve as far as new cases go, and we'd like to keep it that way. In discussions that I've had with other epidemiologists throughout the state and some of the major metropolitan area, they're currently experiencing increase in cases, whereas we are the one city that has had a decline or flatness in our curve. So we'd like to keep it that way. And ways that you can keep that curve flat is to continue to use those protective measures that will prevent your risk of exposure to COVID-19. That includes wearing your mask. It includes washing your hands frequently, social distancing, and also staying home when you're sick, and that's what's vitally important. And if you've been exposed and you're quarantining, or if you are sick, you need to stay home and isolate. So you need to make sure you're following those control measures to reduce exposure in the community. The other thing that we can do as we enter in cold and flu season is to make sure that we are getting vaccinated for flu, for added protection, to protect yourself from flu as well, since we're about to come into that busy time of year when colds and flus and allergies are also present.
And I'll echo some of what Janet just said. We're relatively flat right now in terms of cases and hospitalizations, admissions to the hospital, and flat is an okay place to be. And it's okay because over the past month, 2 months, we've increased our risk a little bit. a little bit at a time. We opened schools starting after Labor Day at 25% and then 50%. This week we've had AISD open initially at 25%, followed by 50% in a couple of weeks. And we've been able to maintain that flatness of the curve, which means folks are doing a great job. But I think there's some confusion. Some folks asked me, earlier this week, Dr. Escott, when is the second wave going to come? Well, the answer is the second wave comes when we decide it's going to come, when our community decides they've had enough of the masking and distancing and protective actions. This virus is not a supernatural force. It responds to what we do as a community. If we reduce those protective actions, if we decide to stop masking and social distancing and we start to gather together again in large groups, that's when the second wave is going to come. So I don't have a prediction on that. My hope is that through education, through listening to expert advice, we can continue to keep this virus at bay in our community and protect one another. And, hopefully we can avoid adding to the case totals, the fatality totals that are unmistakable in the impact they've had across our country. And with that, I'll turn it back to you for questions.
Thank you, Dr. Escott. Now we will go to our pool reporter representing KXAN, Tom Miller.
All right, thank you all for talking with us this morning. I want to start with my question, which is, do you feel comfortable with the level of extracurricular activities happening at schools in our area? The entire Stony Point High School football and volleyball teams in Round Rock are in quarantine after possible exposure. I guess I want to know, is allowing those types of activities an unnecessary risk?
Well, I'll start by saying, we had concern about extracurricular activities from the beginning. This is why we didn't allow football teams to practice over the summertime. And, we've echoed that concern in our direction to our school districts with the encouragement that for those activities where masking and social distancing are not possible or practical, that they notify the families of those students so that they understand that not only is there increased risk of transmission to that student, but also to the household. Further, we've made a recommendation that if students are going to be involved in those activities, which we know are going to increase their risk of transmission, that they mask and social distance at home to avoid spread to other family members. The TEA has made the decision that sporting activities and other extracurricular events are up to the boards of the school districts. So I think this is a issue that districts across our community are going to have to continue to weigh in terms of whether or not it's unacceptable risk.
All right, thank you. Our next question comes from CBS Austin. The governor has hinted that he may reopen bars today or soon. Do you think it's possible to reopen bars safely considering what you've said about the risk in the past? Could any changes at bar operations be enough to mitigate that risk?
We are currently working with our environmental health service as well as bar owners to examine some guidelines that may help reduce the risk of transmission if the governor makes the decision to open bars. I will say that the evidence that we have regarding methods of transmission in our community strongly points to social gatherings. So these are gatherings outside of establishments like bars. They may be backyard parties. They may be other gatherings associated with things like football games. But it's unmistakable that when people come together face to face without masks on for longer than 15 minutes, the risk of transmission is going to increase. So there would have to be substantial changes to the way a bar functions in order to make it safe.
And I would like to add that in social gatherings, oftentimes you are gathering with people that you know. In a bar setting, you may not know who you are congregating with. So from a contact tracing standpoint, following up with positive cases that are associated with social gatherings may be a little more easier to do, and we may get better compliance than trying to do contact tracing for people who may be exposed in a bar situation.
Okay, our next question comes from Estonia. Dr. Escott said yesterday that while there is some limited spread in school settings, it hasn't exploded. Is there any evidence that students who have contracted COVID-19 are spreading it to their families or others outside of the school setting?
I'll just say that throughout this pandemic, we have actually seen disease transmission in households from either the child to the parent and vice versa, parent to the child. So we have seen that happening throughout the beginning of this pandemic. Anytime you have a situation where you have somebody in the household who is a positive case, it increases the likelihood that transmission will occur in that household once it's introduced.
And again, I think this is wise advice for student athletes as well as other individuals in extracurricular activities are those who are taking more risk, going to parties without masking and social distancing. For those individuals, they need to mask and social distance within the household. We are concerned about transmission between students because that may lead to further transmission outside of that age group. In particular, we're concerned about that transmission within a household. And it's up to those students to ensure that they are protecting other members of their household who are going to be at higher risk for hospitalization and higher risk for severe complications, including death.
The other thing I would like to add is that was another one of the reasons that we set up our isolation facility. In those instances where we have individual family members that may be living in multi-generational settings, it's really good for them to take advantage of that asset that we have in the community at the isolation facility. That facility continues to remain open, and we definitely encourage individuals to use that asset in our community.
Our next question comes from K-View. Bars are suspected to reopen soon, but if you go to Rainey Street on a weekend, the bars seem to already be open for business with strict restrictions. Do you suspect another spike in cases if Governor Abbott gives bar owners looser restrictions? And do you suggest that Austinites stay away from bars for now?
I think that bars are going to be a challenge because of the nature of what happens. People take off their masks. They're generally not social distance. They are interacting with individuals outside of their household. So yes, I think it will increase the risk of transmission in our community. I think people have to make decisions on whether or not they want to take that risk. I think certainly if an individual has underlying risk factors or a member of their household has underlying risk factors for severe complications, they absolutely should not be going to a bar at this stage.
I echo what Dr. Escott has stated. We are definitely concerned about bars because of the nature of the business, what typically may happen in a bar setting. One of the things that, we are really acknowledging is our environmental health staff have been working on some guidance. And with any other area that has reopened, we are willing to provide technical assistance. currently for those facilities that are open just across the city, our environmental health staff have been providing technical assistance, but we have also provided some warnings to them as well due to non-compliance. So we will continue those efforts.
Next question from KOOP Radio. With the over-politicization of potential vaccines, what are you doing as public health officials to learn the true circumstances of their development and medical viability to guide the public to the confidence necessary to make its universal use effective?
Well, we do what we do with any type of vaccine or medical treatment, and as review the literature. You know, a lot of what we have seen so far related to vaccines have not been published in peer-reviewed literature. And I think Austin Public Health and physicians across our jurisdiction will turn to that scientific information to ensure that vaccines are safe and effective before we're going to make the recommendation that they be administered.
Next question from Univision. As stated before, students are being exposed to COVID during social gatherings. More recently, a party where 50+ high school students are being quarantined. Can we know the name of the high school? And what are the recommendations for parents who are allowing their kids to socialize outside of school with friends?
So I'll start by saying we're not going to release the name of the school because it is an ongoing epidemiology investigation. But certainly if we find evidence that a law was broken by hosting that gathering, then we will refer those for criminal charges. You know, again, advice to parents is be reasonable. Understand that this disease has not gone away and that there are risks. The risks for young people are small, but they're larger than zero. And certainly, if an individual suffers a serious illness or death, then I do think that more serious charges should be referred. We all have to take responsibility for our actions. We all have to take responsibility for our children. And the advice that I give to my children are that they don't go to those gatherings. And my hope is that other parents across our community will continue to help us help protect our students and our teachers so that we can ensure that we can continue our schools and maintain their opening throughout this semester.
You know, it's going to be important that as a parent, and even if you're not a parent, you know, maybe you're an aunt or, you know, an uncle or something like that, but we are really looking to the adults to make the best decisions that they can make for their students and their children. It's going to be really important for us as a community, as I stated earlier. We can get at a point where we get too comfortable. And so once we start to get too comfortable, that is when we can see an increase in the positivity rate. And we are no longer able to mitigate the spread of disease. As we know, for young children, you know, it may be a minimum impact to them. But as Dr. Escott stated, once they return home and that ability to spread COVID through their household is really going to be significant. And our trends have shown us that. Our contact tracing and case investigations have shown us that transmission is happening from family member to family member.
Okay, this next question comes from Community Impact. Families are beginning to make plans for their children to participate in Halloween and potentially for holiday gatherings, including Thanksgiving and Christmas. What advice or cautions do you have as people consider travel and family or community gatherings this holiday season?
Well, I think that you know, this holiday season is going to look different. I think we've got to understand that, you know, again, this disease has not gone away. And looking back over the past 8 months, we've seen story after story after story across the United States of families that have been absolutely devastated by COVID-19 because they had a gathering. Maybe it's a birthday party, maybe it's a celebration for a holiday, maybe it's a baby shower that has resulted in multiple family members hospitalized and multiple families dying from COVID-19. I think to show love for our family this year, we have to do distancing. We have to have distance celebrations. Our celebrations right now should involve members of our household, and that's it.
All right, thank you. Next question comes from Fox 7. Please give us a history of the spread of COVID-19 in our area from March to now. Have our actions we've taken worked, and how much longer will we have to take precautions?
I'm not sure if you can still see me or not, but I have a frozen screen. There it goes. So, the disease has had, a substantial course in our community. We had the early caution, the lockdown that bought us time. And some people are asking now, why did we lock down back in March and April? And the answer is we didn't have PPE. We didn't have testing. We didn't have a great inventory of ventilators. So we had to be very, very cautious at that stage. We didn't know a lot about the disease itself because it was brand new. Now we know more. Now we have more evidence. We know that masking is very effective. I think that, when we look forward into the future and think about the protective actions and how long we're going to have to continue the masking and distancing, it's going to be until we have a vaccine which is widely available and been utilized by our community. So I think that 6 to 9 months is going to be the minimum for that.
The other thing that I would like to add to what Dr. Escott has said is that, over the course of, this pandemic response, we have learned more about COVID-19. Some of the things that, I'm always applauding our community, but I also like to applaud our Austin Public Health staff as well as our elected officials. We've come together to be able to put mandates in place that will keep our community safe. A few things I would like to point to is that with our internal operations to the city of Austin and Travis County, we have closed parks around Memorial Day, 4th of July. And what we've noticed is, as a result of us putting those measures in place, we've been able to really get to this place to where we are today. And as we gradually recommend and work with our partners about opening up a little more, we've been able to provide some guidance, as well as working very collaboratively with our partners. And so as we continue to reopen more things up and work very closely with our partners to put strategies in place to mitigate the spread of disease, it's going to be important that everyone knows that we have the health and safety of Austin Travis County is our #1 priority.
This next question comes from KUT. Is APH working with Travis County, or are there plans to do so to help poll workers and polling locations stay as safe as can be expected during early voting and election day? If so, what are the plans?
So I participated in creating a video for poll workers a month or two ago to talk about the safety of polling locations. And the Travis County Clerk has done a great job of securing equipment, PPE for poll workers, and designing a flow through the polling places to keep the poll workers and voters safe. They've done just a fantastic job of ensuring that regardless of transmission activity in November, that people will be able to cast their vote in a safe way. And again, I want to recognize the great work of the county clerk in that effort, and certainly reassure folks, particularly poll workers, that we will continue to monitor the situation and change any advice, improve any measures that we need to based upon the disease on November 3rd.
Okay, this next question is from us at KXAN. What impact has President Trump's statements and actions since his COVID-19 diagnosis had on public health messaging in the fight against the virus? Do you worry people in Austin will let their guard down because of it?
Let me just say, I think as leaders, we have to choose our words carefully. We have to ensure that the message that is coming out is the message that we intend. And I think that we're getting some conflicting messaging from some leaders. I think we all need to be unified in the fact that this disease is real. It's killed more than 200,000 Americans. It's infected millions. And there are families who will be forever changed as a result of this. We should not minimize the impact of this disease. We shouldn't equate it to things which are not its equal. We have not seen its equal in quite some time, and we need to respect it. I will say that we don't need to live in fear. We do need to live in respect of this disease because of its impact. And the difference is between fear and living in respect is that we can utilize the information that we have to make it safer for ourselves and our family. I do want to recognize that there are many leaders who have done a great job of ensuring the message is clear and consistent. Our local elected officials have done a great job of that. I recognize groups like the NFL who have come out very strongly regarding masking, finding coaches and staff who are seen without masks on. I think as leaders, we have to set an example. And certainly we expect that from our leaders in the federal government.
I would like to add that, I agree with Dr. Escott. As a leader, you are called to think about not just yourself as an individual. You are called to think about other people that your influence can really either add to a positive or a negative consequence. And so as you think about that, we at Austin Public Health across the city with our elected officials, our Mayor Adler and our county judge, we have kept, and Dr. Escott and the rest of our team, we have remained consistent. You can go back months back from now and look back at the messages that we have provided, and we have remained we have really remained consistent in providing the same messages because we know that COVID is here. It is going to remain in our community even after we have a vaccine and a cure. It is a notifiable condition, and so it will be continued to be reported on by whether it's the local health department and or a physician. And so as leaders, we've got to take a stance, and it cannot be about me as an individual. I have to be thinking about the overall community and the people that I lead.
Next question from CBS Austin. You said APH is working with bars to figure out how to make reopening safer. What are some examples of the changes that could be made?
So some of the changes that we're looking at right now are related to people being seated at tables rather than milling around in a bar, about ordering at a bar safely, rather than people crowding it at around a bar trying to order their drinks. So these are some of the things that we're looking at, some things that other states and jurisdictions have done to try to mitigate that risk of transmission in a bar. Again, I think that with substantial modifications, that bars may be able to operate. And we've certainly seen those modifications happen throughout our business community in Austin. The Austin Chamber has done a great job of being a sounding board for those ideas. We first saw it with grocery stores and hardware stores, and then we saw it spread to retail establishments as they opened. I think that restaurants are doing a good job of mitigating risk, and if we can identify appropriate ways to mitigate that risk in bars, then we can help to decrease the transmission and make it more plausible that we could open them safely.
Our next question comes from Estonia. Actually, let me skip that. That question's not in. Let's go to K-View. As of right now, you said it's safe to return to school buildings, but teachers in some school districts are telling us they're seeing many COVID-19 safety violations. What do you suggest teachers do if they continue to see these health risks?
So teachers, every school should have a single point of contact to report concerns or violations of the safety plan. This is true for COVID as well as other safety items. And again, I think it's important that teachers voice those concerns to those individuals as well as their administrators. Ultimately, the school plans are the responsibility of the school boards at the individual school districts. So I think it's also important for teachers to share those concerns with those elected officials who are ultimately responsible for making the decisions regarding the safety measures as well as the funding available to enhance those measures.
Next question is from KOOP Radio. The virus remains with us and into this foreseeable future. How do we then continue to protect ourselves and our community if the orders that have gotten us and keep us safe are relaxed by the state?
I think it's going to be important I think it's really going to be important. That was one of the reasons we put our risk scale together and our guidelines that we put on the website. Each individual per household is definitely going to have to establish this is going to be the behavior that we're going to take within this household. So even though things may open up, there may be more opportunities to go to additional places, to have other outings. Each individual has to make that best choice. And we continue to just emphasize that if they are going into if they're going out to eat to a restaurant, make sure they take their face coverings with them, ensure that they are socially distanced. When they're not eating, make sure they have the face covering on, make sure they are washing their hands. And so those things have remained constant. And so as a family and a household, it's going to be important for them to continue those efforts. There may be, just because things are opening up, that may not be the case for you and your family. You have to take make the best decision for you and your family, because you're going to know what type of risk your family may have from any underlying medical conditions.
And let me just add, we have a lot of points of division in our country. We have a lot of issues that are politicized. It's important that this one not be. Earlier in June, when the city and the county came out strongly to support masking, we saw an impact and a decrease in the rate of transmission. When the governor unified that message through his mandate, the transmission fell off a cliff and dropped very, very rapidly. I think this is a serious illness that has killed more than 200,000 people in our country. This country needs a unified message. We have to make the deliberate decision to not fight about this issue so that we can be impactful and we can buy ourselves more time until we can get a vaccine publicly available.
Okay, this next question is our last question, and it comes from Univision. As the average hospitalizations are going down, when can we expect to move to stage 2?
Again, the decrease in stage is up to all of us. And if we continue those protective actions, we continue the masking and distancing, the personal hygiene, and staying home when we're sick, it could be soon. We are not far away. We've hit 12 on that 7-day moving average 3 times, and 3 times we've bounced off of it to go higher again. So we've had this oscillation for several weeks now. If we stay committed, if we manage our risk, if we avoid those social gatherings, we can push through that barrier, but it's going to take all of us to do it.
Thank you, panel members. Now we will go into our final remarks. We will start with Stephanie Hayden.
Just as a reminder, education is our priority. And in order for us to ensure that our students receive the education that they need and are in a safe environment, we've got to maintain the process and ensure that we don't get too comfortable. We have to continue to wash our hands, stay at home if you're sick, use your face coverings. And the main thing is that there are some, whether they're family gatherings or parties that you may be attending, those are not essential. We really need you to think about new traditions that you can have within your family. There are some things that you may have done earlier this year to celebrate your holidays and milestones. We want you to continue those traditions that you've established this year. It's important for us to know that it's flu season, and we encourage everyone to get their flu vaccine. It is so important for us as a community to ensure we have as many people to receive their flu vaccine so we can be a healthy community. We do not want the emergency room and the hospitals overrun by individuals that have the flu, when this can be avoided by getting a flu vaccine.
Janet?
Yes, and I'll just add on to what Stephanie had to say, and that is, again, we are seeing declines in the number of cases that we're receiving on a day-to-day basis and what we're actually investigating. And I think it's very, very important that we remember we want to continue to lead the state in having that decreased number of cases and the flattening of our curve. And to accomplish that and continue to keep that number down and not see a second wave. I don't want to see a second wave, but the ways we're going to get around that is to make sure that people are using those prevention measures that we've been discussing since early January, and things that we say every flu season as well, you know, to cover your face, cover your coughs and colds, stay home if you're sick, where in this case, wear your mask and social distance. If you are in quarantine, you need to stay in quarantine until you finish that 14-day period. If you are in isolation, you need to make sure that you are staying in isolation for a 10-day period or until your symptoms resolve, and that you're fever-free for 1 day. But we need people to do these things to make sure that we are going to protect our community at large. Again, I can't overemphasize the importance of having a flu vaccine and getting those in your household vaccinated for flu. And I'll leave it at that.
Again, as Janet said, our disease trends right now are flat. And flat is okay because we're increasing risk. When it comes to the second wave, we again have to remember that the second wave comes when this community gets tired of the protective actions. We can avoid a second wave if we stay committed to the masking, the social distancing, and the personal hygiene, including washing your hands and avoiding touching your face. Most important of all of them is staying home if you're sick. As we enter cold and flu season, there's going to be a lot of other reasons to have a runny nose or a sore throat or other symptoms. We have to assume that those symptoms are from COVID-19 and stay home and schedule a test so that we can protect our families and protect the community.
Thank you. That concludes our media availability for today. A special thanks to APH Director Stephanie Hayden, Dr. Mark Escott, epidemiologist Janet Pichette, and our pool reporter representing KXAN, Tom Miller. Thank you. Have a great day.
Thank you.